All right, and welcome to Run Good Lifestyle. And today I'm going to talk a little bit about the healthcare system. And I know this may be, I won't use the word controversial because I don't think my opinion matters to that many people, but it is definitely a hot topic. And I basically want to talk about Robert F. Kennedy Jr.'s take on the healthcare system and where we're going with that. And as many of you know that have been on following what my journey of wellness, I've gone down the path that I believe he is trying to propose a more, I won't say alternative, but preventative type wellness, and instead of the healthcare system that is prioritizing costly treatments. I want to look at, I'm trying to do more prevention and wellness. So, and a lot, in my opinion, a lot of the chronic disease issues are due to the fact that here in America, big pharma, big tobacco, big food industries are so influential in how we eat, how we purchase our foods, the foods that we're purchasing. And I believe that changes have to be made. We are one of the most unhealthy nations in the world. Now, that being said, I don't want to sit here and bang the U.S. because, I love where I live. I love being part of a free country and all that America has to provide. So I'm not here to, say I don't love America. I do. I think there's changes that need to be made, and and I'm just particularly talking about how we take care of our bodies and how we are getting our food and the information that we are told about our food. And I think that even though, I don't want to turn this into, like I said, a political stance, because, I know that if the far left doesn't like what RFK Jr. says, and the right is all in on everything. So I'm somewhere, I don't want to say in the middle on this, because I really am all in on what he is trying to do and the changes he's trying to make in this particular instance. But I feel like if you're far left or far right, I just feel like there needs to be some kind of common sense coming together and for the good of the people. So, I'm not here to preach politics. Let's just put it that way. And hopefully we can shed some light on this. And, just because you advocate for reform doesn't make you, I don't know, a target. And I feel like anytime there's change needed, there's going to be, pros and cons. But our current healthcare system is in trouble. We, doctors and all the medicine that we have is great, and we need that. But if we can look on the other side and do some preventative medicine, some testing and stuff like that, why don't we look at that? And why don't we try to change the system that has really put America at the bottom as far as healthiness of their people? We are towards the bottom of the healthiest people in the world, and we're at the top of spending in the world on healthcare. So throwing money at it obviously hasn't been the cure. So the focus on prevention and wellness and corporate accountability, I think that's where progress lies. And you know, we can go on about vaccines and those kind of things, but I really want to stick to, you know, Robert F. Kennedy's motto. And you know, I'm not trying to put this with Trump's motto, make America great again, but I believe let's make America healthy again. Let's start with that. You know, prevent disease, get a food policy and a reform policy that the FDA, when the FDA stands behind a product, we can believe it. Right now, me personally, just because it's FDA approved doesn't mean that I feel safe eating it. And you know, it's been documented that countries used to use our FDA program as a catch-all for them because they didn't have a program in some of these countries to do the research and make sure that the food that they're eating is healthy. And I know some of those countries have literally stopped using the FDA because they can't trust it. And that's sad. You know, we should be at the forefront of that, where we can be trusted, and what comes out of the FDA and should be good information, not tainted information. So, and we could do a whole podcast on just that. And then next is, you know, access to alternative medicine. Yes, I'm not looking at crazy alternatives, but you know, when I went down this path of trying to find out what's going on in my body as far as where my body stands on the vitamins and minerals that I need, you know, just me personally, I'm not, I wasn't looking for, you know, what's wrong with me. There's really nothing super wrong with me, but I could tell that as I got older, I wasn't processing foods the way I should, or I wasn't feeling the same as I was. So, you know, I went, as some of you have followed me, I went down the path of trying to find out why, you know, what's going on. So when I went down this path of the wellness and talking with my Dr. Janice Jackson, who I had on here, if you haven't seen that podcast, she's awesome and some really informative information there. But when I went down that path with her and tried to use my healthcare insurance, none of it was covered. And the reason being because I wasn't having any medical issues. I was trying to do preventative care. And so everything that I did as far as getting the blood work done, talking with her on alternatives as far as vitamins and other minerals I could take and start boosting what was deficient in my body, I had to have all that done out of pocket. And, you know, fortunately, I have the means to do that. Not all Americans have that ability to spend a few $1,000s to find out what's going on with them. You know, they have to have their their insurance companies approved, or some of them don't have insurance, and that's just not where we should be as a country. We should be able to go and have, I'm not saying have free health care, but we should have the ability, if we do have health insurance, to have these procedures covered under our insurance to save money in the long run. You know, it's to the benefit of the insurance company to have a healthy community. and not treat it after the fact when it's, I won't say it's too late, but it's definitely harder to treat, and could have been some in some instances been prevented. Now, that being said, when there are issues that you need right now, obviously we got to have that urgent care and urgent procedures and those types of things. But some of these health issues, like diabetes and so there's, I could go on and on, but there's a lot of health issues that can, I won't say be totally prevented, but can definitely be curved in the right direction, where if you're being given information on the correct foods to eat, the amounts of food to eat, and just eat the correct stuff and go down a more preventative and a wellness type of path, this, maybe we can turn these numbers around as far as the most unhealthy, or no, I won't say the most, but on the bottom of the most unhealthy countries, and spending as being a top priority on what we put out there. So um, I would like to get other people's opinion on where you stand on this. I mean, it's not necessarily right. It's not a one fit all type of a situation, and everybody needs to be able to go down the path they feel that's appropriate for them, and without that being available to 100% of the American people, then it's hard to get behind. So going back to the vaccines, I'm not an anti-vaxxer, but I noticed a lot of changes in my health once I got the vaccination for COVID, and that's honestly that time period is when I just started getting involved and trying to find out what's going on with me. And the first thing we looked at was the shot, and I think it's been well documented, those types of situations just wasn't right for all people, and we rushed into a vaccination because of the scariness of COVID, me being included. I couldn't wait till a vaccine came out. Then come to find out, the vaccine, not only was the vaccination not really needed by me, not saying not everybody was in the position that I was. I think the people that had other health issues and other health problems, I think that maybe that vaccination may have been what they needed. But for the healthy American who isn't overweight or over, I wouldn't say overweight, that's a bad term, but isn't in the same type of medical condition, maybe we all didn't need that shot, and we were led down a path of just being misinformed. And not just with the COVID shot, I think I've said this before, but I've just recently became a grandfather, and I looked at all the shots that the immunization shots that these babies take, and I was just blown away at the number of shots that I took as a child when I was a baby, compared to the shots that my grandchild was being told they needed, was just astronomical. And I don't think that I don't want to get into what people should or shouldn't do, because I am not a medical doctor. But in my opinion, let's take a look at this, and I think that's part of RFK Jr.'s policy. Let's take a look and see what is needed. I don't know. I'm not a like I said, a medical doctor, but when you see the rise in autism at the numbers that we have, the rise in other deficiencies that we have now, let's look at the whole ball of wax. Let's don't just say, all right, let's don't do any vaccinations, but let's also don't say, hey, let's carte blanche give everybody 180 vaccination as a child, as a baby, as a newborn. It's just insane to me. So I don't know exactly what we need to do, but having open communication about it is paramount. And again, I'm not advocating a political party in this, but RFK Jr.'s stance on these are in line with the way I feel. I think that having some common sense behind these thoughts, not just because you're being backed by big pharma to say you need this, is important. And when I remember way back when the tobacco companies were doing the ad campaigns for smoking, and they did a wonderful job of promoting cigarettes. And once we found out that the stuff they're putting in the cigarettes and the stuff that is highly addictive that keep you smoking, and the health ramifications of smoking these cigarettes came to light, those types of ads, those types of people, I think I forget the number of percentage of people that smoked in that early heyday of that, but it was a high percentage. Everybody was smoking. It was cool. And now, because of the health issues surrounded by smoking, now it's become uncool. And the food and drug people took what, in my opinion, took the people that were advocating smoking and took the food and drug advertising to that level. And that's where we are now, in my opinion, where we're getting told that, I remember seeing Campbell soup ads, the healthy alternative, you look what's in those Campbell soup cans, and it's just full of salts and just preservatives and stuff that just is horrible for you. So, going back to part of, Robert F. Kennedy's Jr.'s plan, is, he fired a bunch of people in the federal agencies. I'm not sure which departments, but the downsizing and making sure that we have people that are at the FDA for the right reasons, not for a stepping stone for a job at one of the big pharmas or big food companies. When you get in bed with the big food companies as an individual that is supposed to be testing these foods, and all of a sudden you give them a favorable market to market either drugs or food, and then 5 years later you're working for that big company making thousands, hundreds of thousands of dollars. That's not right. And I think that's some of the stuff that RFK Jr. is looking at is there a conflict of interest of the FDA and big pharma, big food, people that are just throwing millions of dollars at these researchers to make sure they get favorable opinions or favorable, I don't know what to call them, just favorable information so they can sell their drugs and their food. And on that same line, the food labeling and oversight of the processed foods that we intake, that's one thing that, when I went through my testing, my processed food intake was incredible. And some of the stuff I didn't even know about. I don't want to get involved in that. You got to do your own research for yourself. But man, it made me half sick to my stomach, the additives that I was using, the unhealthy options of food that I was eating at the time. And this goes back from when I was in school. I was like, if my mom didn't make me lunch, I didn't know what I don't know what I was eating. So I was fortunate that I had a mom that, made me lunches to take to school. So, the kids today, the food they eat at school lunches is just crazy. I mean, I remember my kids' lunches, and hasn't gotten any better. But hopefully, that's part of the reform that we can start with, getting our kids informed and giving them options, giving them healthy options. Like they just need options. That starts, when you start young, of, maybe, a can of tuna is not bad for you. That little bit of mercury that's in that can of tuna is not bad for you eating at one time, but eating over a 30-year period, it multiplies, and pretty soon that one can of tuna turned in 2,000 can of tunas, and the amount of mercury in that can of tuna has changed your health for the worse. So, having informative information out there for kids to make and for parents to make for their kids is paramount. So, I see a lot of questions here. I really don't want to. I was going to put some of them up there, but I'm getting a bombardment of both sides of the fence. I think we can agree that there's a happy medium, but I'm going to continue to go down my journey. I hope that this at least gets you to think about your journey and where you want to be in life as far as your health goes, and what types of foods you want in your life, and the types of information that you're getting. Do you feel like it's information that's stuff you can believe in? And that's what I want. That's what I want from our government. That's what I want from the people that are profiting hugely from the foods we eat, the drugs we take, drinks we drink. And let's make America healthy again. That's all I ask. I want to be healthy. I talked to a gentleman the other day, and he made a great comment. He said, when you're healthy, you have a million problems. There's always something you can work on. But once you have a health issue, you only have one problem. Think about that. When I talked to him, he was going through we're still going through it, some health issues, and he wakes up every morning with one problem. That's getting healthy. And I'm not saying that his food or his lifestyle was the cause. I mean, there's many reasons why, but why not, if we have the opportunity to make our lives healthier, why wouldn't we do it? Why don't we use common sense and get the people that really want to change the situation for the better, give them the means to do so. All right, I think that's all I have right now. I want to thank you for listening, and I will respond to all the questions that I got here. And I see that there have, at least we have struck a chord where there is some interest. This is a topic that people are interested in, and I love to have open conversation, and I'm going to do some more of these as I continue my journey. I'm now 2 months, almost 3 months into the vitamin minerals that after I did my blood testing, which was quite extensive with Dr. Jackson. I went on a protocol through her, and it'll be interesting. I have 3 more months, I believe, and then I get retested to see where my levels are. And I was extremely shocked at how low some of my vitamin levels were, and some key vitamins that, you know, just help your body age or age quicker, in my instance. And hopefully those things are going to be turned around, and these are things that I'm probably going to continue. If I do see the changes, I will, hopefully there are changes for the better. It'd be interesting. I'm super excited to see how that comes out, and I will definitely give you the rundown once I have that. But again, I hope this made you think a little bit, and I hope it made you want to be on board with making America healthy again. So thanks for watching. I want to thank my sponsor, the Winston Insurance Agency. If you ever need an insurance quote, call us at 740-653-5535. Winston Insurance for all your insurance needs. And thanks for listening. And we will be back with more information. I have two podcasts going. I have the Health and Wellness podcast, and I also have my Sportsbook Edition podcast. And I'll be interested to see how I'm going to do that this week. I have a member guest coming up this weekend. So it starts Wednesday, and it's going to put a little crunch on some of my podcasting. But if you have any other questions or anything you'd like to know more about, I'm all ears and would love to have some suggestions. And again, thanks for joining us, and go to my YouTube channel and subscribe, Run Good Lifestyle. And I have Run Good Lifestyle, the Sportsbook Edition. There's a lot of good information about that arena. And we look forward to talking to you soon. Thanks again.